I do have a question for you guys, for you and Jim as well. If you try to combine the two talks, you told us that we lie, which is certainly true, and we do have an important role of cognition in any kind of instances relating to sexuality. What about sexual orientation? Whenever you are going to try and combine the two, the behavioral point of view and the cognitive point of view, are we able to explain sexual orientation and the lie behind sexual orientation in this kind of, perspective?
What exactly? I mean, I'm not sure if I got exactly what.
If you try to explain why, for instance, the subjective part of the coin is more than important than the genital part of the coin. If you're trying to translate this kind of perspective into the sexual orientation world, which means men who have sex with men, most of the times do have a real perception, I would say, do have a real feeling what is subjectively important, and sometimes this is not related to the genital, part of the coin. Are you able to explain from the behavioral standpoint and from the psychological standpoint such kind of issue?
Okay, I'll let Jim, just to say that actually we did not until now studied men and women with
secular,
with
homosexual.
With
okay.
homosexual. We have actually. I have actually one postdoctoral student who's going to study. Actually, the doctoral study was more on clinicals, so kind of, I would say, this is also maybe related to your question. What we studied was actually men and women with homosexual orientation, let's put it this way, so lesbian and gays. And we compared this group of people with heterosexual men and women. And this was not in the lab, this was self-reported, retrospective studies. But what we studied actually was cognitions and emotions, self-reported cognitions and emotions, and also sexual beliefs. And what we found out, it's interesting that both, what differentiates clinicals from controls, so men and women with sexual dysfunction from men and women without sexual dysfunction, is in the most cases more close together than what differentiates men and women with homosexual versus or heterosexual orientation. In other words, we found very similar differences regardless of sexual orientation. So the sexual beliefs of men and women with sexual problems were very similar in regardless of being homosexual or heterosexual. And also the cognitive pattern during sexual activity, so this kind of thing, sexual thoughts during sexual activity or negative destructive thoughts and so forth, and actually emotions, positive or negative. So the pattern is very similar regardless of the sexual orientation. This was conducted in Portugal, not in the lab again, but I would think that the differences will be not that much, I would say. So if I have to predict, I would predict that there were more similarities than differences.
Okay.
And I mean, I actually have a question for Pedro as well, but to kind of get at this, I don't think you're going to find gay rats or lesbian rats. Not in the same way that we have a sexual orientation. I don't think rats think about that. In that way, they do just do it. They do what they want when they want. Now, could I get a male rat to mount another male rat? Sure. I mean, there are many ways to get him to do that. If I were able to talk to that rat, I don't think the rat would tell me he's gay and that he's part of a movement or something of that nature, that he's defining himself by his sexuality. I mean, he probably defines himself by his sexuality when he's being sexual, and then defines himself by the food he's eating when he's actually eating. So I think it's probably in that way, I don't know that we could ever get a rat model of homosexuality or even heterosexuality as we understand it, because we're consciously aware of it, right? And the conscious awareness thing is the thing I wanted to ask Pedro, which I think is a really important question. So in the sexually functioning individuals, you have, I'm not going to call it discordance, but you have things that load factors that become their own entities. When they're sexually dysfunctional, they blend. Is that because there's a greater conscious awareness on the part of the dysfunctional individuals of things not working? And, you know, even whether they're consciously or subconsciously aware of it, trying to find a root cause of it, or saying, well, this doesn't work and that doesn't work, and my God, is this going to work this time and is that not going to work this time? Am I going to get aroused? Am I going to have desire? Is it because they're fractionating together that we become consciously aware of it, and then in an attributional way that, of course, is reflected by the factor analysis, those things start to load together? Right? So, I mean, it's almost a chicken and egg question, but I mean, I'm wondering, when things are working fine, we just don't think about it. Am I going to get lubricated? Yeah, I'm sure I will at the right time. You know, that's always preceded by vaginal pulse amplitude, because you got to get the blood engorged in order to generate the mucus. But, you know, you're looking at different times for different things, but one would probably make an expectation that everything will be working normally, so you don't have to think about it. Whereas if everything doesn't work normally, you do have to think about it, and you probably do.
That's a very interesting question. I don't know, I don't have an answer for you directly, but of course, I would say that, how can I put it? If everything goes well, that's a good way of, actually you put it that way. You don't need to think. You just feel. You just at the moment. But of course you're thinking, and your mind is working, and you have emotions and so forth, but you don't think about it. You just let go. So it's kind of, you are in a mindful state at some point. So let's put it this way. People who don't have sexual problems, actually, during sexual activity, they are in a mindfulness, let's put it this way, mode. And of course, actually, Barlow explained this in this old model that, of course, what changed in this mindful, he didn't call it mindfulness mode, of course, but what changed? The main changes were, of course, preoccupations, worry, anticipating failure. So it goes even back. I would say that expectations are already there, so before starting. So in a way, if you want to think in a clinical way, so men and women, we know more about men of these specific worries, but this happens also in women. They expect to fail. They are worried about the next. They are worried about failing. They are worrying about disappointing their partner. They are worrying about not having an erection, not having orgasm, and so forth, not even having desire to start with. So, so in a way, it's more just the moment. It comes before. It's an expectation. It lives with you. So it's let's put it in a way, it's also linked with emotional disorders, because it's kind of an anxiety and also depressed mode, which also may explain the high comorbidity between sexual dysfunction and depression actually, and actually also anxiety disorders. Because most of these men and women who really are worried about this problem, because we can have the symptom but do not look for help, because so that's another issue. But if you are really worried about the problem, if you're going for help, and most people will go for help and ends in sex therapy clinics, are people usually went first to the urologist and the gynecologist and so forth. So it's something that it's everything in your mind. Some people say it's, of course, not everything in your mind, but the mind is very, very important. So when they get there, they are really very worried and preoccupied overall. So it goes more than just the sexual life. And this negative expectation, it becomes in the back of their mind always and always. So not sure if I addressed what you...
Pedro, I would like to have your interpretation on one of your last findings concerning the positive thought in normally functioning men and women. You demonstrate that they explain in both gender a significant amount of variance, but in women was double than in men, 75% against 37%. Which is your interpretation about this point?
That's a very good question. I'm not sure about it, but it may mean that actually in women those thoughts are very, very powerful, actually more powerful in predicting subjective arousal than in men, definitely. So it might be explained also by, of course, let's put it this way, the interconnection between mind and body might be different because of anatomical differences. So in men, there's studies on that also. In men, the interaction between erection, we can see our erection, so it's much more connected in a way, although whereas in most women, there's no, the feedback on sexual arousal, physiological sexual arousal is not that much, how can I put it, clear. So in one end, it could be related to that. So, but on the other end, it might, I'm not sure about this, but it might be that sexual thoughts and emotions are more powerful in predicting subjective arousal in women, definitely, but I'm not sure why exactly. We have to expand we have to try and test that with other experiments.
The last question over there, Professor Jamie.
Thank you, Pedro, for your presentation. I was wondering if I understand well that you mean that positive and thought and emotion can prevent sexual difficulties. And I was wondering if the increase of positive thought and emotion can participate in the increase of sexual activity. And this is one question. And the second one is, what would be, did you study the role of pornography in the development of positive thought and cognition and emotion related to sexual activity?
Yeah, so the first question was if you could enhance positive thoughts in positive emotions, or sexual thoughts in positive emotions may facilitate sexual activity.
May increase
sexual activity. Not arousal, but activity, frequency, and so forth.
Yeah.
I never studied exactly that, so I don't have an answer specifically to that. But I would say that, of course, if you have, again, using gym talk, if you are rewarded in a way, so if your sexual experience is more positive, I would expect them to have more sexual activity, or to be more prone to search for sexual activity in one way. So I would say yes, I would expect that. The second question was pornography. Okay, I never studied exactly pornography in the way that how it could be used to help clinically. Let's put it this way. But we know that at some point, you know, we used in clinical therapy, actually also in cognitive behavioral therapy, we used stimuli to promote sexual thoughts and to promote well-being and so forth. I would say that it will depend on people's preference. So I will prescribe pornography, let's put it this way, if people are familiar with pornography, if people feels well using pornography, and of course we use it that actually in sensate focus. Sensate focus could be a way to enhance sexual arousal, enhance positive thoughts, and we try to use all kind of materials that make you more comfortable or make you more aroused. So to make your experience more erotic and helpful. This is very helpful. But I would say not as the same way, it doesn't work as the same way for every people. But actually in the lab we use pornography. That's another way of putting the question. And interestingly, when we use pornography, of course we use explicit sexual stimuli in the lab, so it's pornography. And what we see is that most men and women respond, actually. Even if they don't respond subjectively, they actually respond, most of them, physiologically, which is also interesting. It's another way of it's another more a question than an answer.
Thank you. Well, we shall move on. Thank you very much.